On this episode of Best Docs Network featuring Forest Park Medical Center, we'll meet plastic surgeon Dr. Jeff Angobaldo, gynecologic oncologist Dr. Jonathan O, anesthesiologist Dr. Peter Baek, plastic surgeon Dr. David Azouz. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back once again with another edition of the Best Docs Network featuring Forest Park Medical Center, one of the premier medical centers in all of Dallas-Fort Worth.
You're right, Candace. Not only one of the premier medical centers in the Dallas-Fort Worth area, but how about this? Some of the best doctors in the Dallas-Fort Worth area operate right here out of beautiful Forest Park Medical Center.
You're right about that. And up next, we're going to take a look at our next best doctor. And more with that is Kelsey Reich.
Thanks, Candace. Our first Forest Park Medical Center physician, plastic surgeon Dr. Jeff Angobaldo, was able to dramatically help one woman's pain by providing her with the procedure she needed.
I had back pain, I had neck and shoulder pain, and my breasts were large. And it made wearing certain styles of clothing just undoable. Over the years, I've gone to physical therapy for my back and neck and shoulder pain. And it would help for a while. And then after a while, it would just go back to the old, same old, same old. And I've taken muscle relaxants, and I would take prescription pain medicine and over-the-counter pain medicines, and it was just not working for me.
Rosetta came to the office for a consultation for breast reduction surgery. She, for her tiny frame, she was very disproportionate. She's always had this, and she was been self-conscious of this since she was a teenager. I believe she was a G or an H, which affected her quality of life. She wasn't able to really engage in too many activities, sports activities, a lot of running or exercise, and she was having a lot of back and neck pain.
I ended up deciding that it was time to do something more permanent to alleviate the situation. And my primary care had recommended Dr. Angobaldo to me. And I went in to see him, and I immediately clicked with him and thought it was a good fit.
Breast reductions can help solve a lot of these symptoms that people are suffering from. Rosetta's surgery took about 4 hours to do, which included liposuction of her lateral breast tissue and her X-ray tissue. She has a very nice result. We removed 3 pounds, a little over 3 pounds of breast tissue. Just imagine if you had a heavy gold necklace with 3.5 pounds and you've been carrying it or wearing it for the last 20 years. So just having that reduction in weight was a huge benefit for her. And she felt it immediately.
I'm looking forward to the fashion options that I'll have now, and just looking proportioned, no more pain. I'm just really excited.
"17 years ago, I fell at work. I've had 4 surgeries total, and after that, I've been through massage therapy, I've been through acupuncture, I've been through the deep massage therapy. Nothing seemed to help with the damaged nerves that was there. I've been to doctor after doctor and after doctor, and finally, after years of that, it's like, why go anyplace else? Nobody can help you. There's nothing to help with the pain, so you just take lots of over-the-counter medicines and try to keep going because you still have to work and feed your family. I was introduced to Dr. Baek here at work. He said he had a new product, new technology out that would try to help with chronic pain. And he had heard that I'd had some knee problems and knee pain, and so he wanted to try it and see if it would work for me.
The PSTIM was actually a device that has been in Europe since about 2000. and it was FDA approved in the US in 2006. The reality is that there is a lot of skepticism initially with using PSTIM, but I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. Once the device is secured behind the ear, mapping of the ear occurs, where I locate nerve endings on the ear which correlate to areas of pain in the body.
It was a very non-invasive procedure. It used little electrodes that gave little impulses. There was no medication involved where you could still drive and work and those kind of things. Your head was still clear, you weren't foggy with it. It makes your day go a whole lot better.
PSTIM is not going to fix her knee, and she will get her surgery to replace her knees. But PSTIM has been able to control or manage her pain so that she's able to focus on other things outside of her knee.
After having 17 years of pain and having this very non-invasive PSTIM placed and being pain-free and being able to do the things that I want to do with my 10-year-old daughter, the whole world has totally changed for me.
What I find rewarding about PSTIM is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
Now let's meet our next best doctor who operates right here out of Forest Park Medical Center. It's General Surgeon Dr. Tom Roshek.
Before I went to go see Dr. Roshek, I actually had seen my family doctor because I had some pains down the growing area. It was severe pain. It hurt to walk. It hurt to do basically just anything really. And it became too severe for me to handle.
Groin hernias either can be one-sided or both-sided. Typically, if a patient has a one-sided groin hernia, I recommend the open hernia repair for that patient. I make an incision in the groin, we fix the hernia, and we'll typically use a piece of mesh to repair the hernia. If the patient has a dual-sided groin hernia, I find that the laparoscopic technique is more beneficial because we can make this small incisions that we use for the laparoscopic technique and fix both hernias at the same time. We found that the laparoscopic technique and the open technique are very similar in regards to durability of the repair and recurrence. However, we've seen that the laparoscopic technique allows patients to go back to work sooner, and a lot of times we'll have less pain in the postoperative period.
When I went to see Dr. Roshek, he did the full exam again, and at that time he discovered a second hole in my intestinal wall.
So in Anthony's case, he was starting to feel growing pain, and he thought it was just on one side, but it turns out that when I saw him in the office, he actually had a hernia on both sides. And this hernia was really making it hard for him to do what he loves, which is mainly he likes to hike. And when he's hiking, he participates in geocaching, where basically you're on a glorified treasure hunt. So it was really holding him back from that. He was noting a lot of pain when he was trying to go hiking and enjoy his life. Once the hernias were diagnosed, we settled on the laparoscopic technique to fix both sides at once.
After the surgery, it was 3 or 4 days. The surgery was on Wednesday. Not being one who likes to be cooped up, a very active kind of guy, I like to be able to get out. From then, it was a little bit more at a time. By Monday, I was back at work.
And since surgery, he's been doing great, and he's out there hiking and geocaching all the time now.
Dr. Roshek, as a doctor, he was extremely welcoming. He's extremely friendly, extremely open, a very good person.
And now it's time to sit down with one of Forest Park Medical Center's best physicians and founders, bariatric surgeon Dr. Wade Barker.
I'm joined now by one of the founders of Forest Park Medical Center and top bariatric surgeon, Dr. Wade Barker. Dr. Barker, thanks for being with us today.
Oh, thank you.
If you would start off by talking to us a little bit about what made you decide to practice medicine and specifically bariatrics.
Medicine is actually kind of a story that started in high school. I really didn't like school to start with. From first grade, I missed school, didn't want to go, and never thought I would go another 13 years after high school. But in high school, the valedictorian was going to be a doctor, and my pride was, well, if he can do that, I can certainly do that. And so it was really a pride thing that got me interested in medicine, and fortunately, I enjoyed the science, I enjoyed, biology and chemistry, and so it just was right down my alley.
And what's the most rewarding part of your job?
Seeing the results for patients and really getting a thank you, in a lot of fields and in medicine in general, that's your job, to take care of the patients and do the things correctly. And so people expect that, but in bariatric medicine, they are so grateful that they always remember to say thank you and tell you not just thank you, but how you've changed their lives.
And in a lot of times saved their lives.
Realistically, that is true in the short term and in the long term in many cases.
You've obviously been an integral part of the development of Forest Park. How did you come to the vision of Forest Park Medical Centers?
Well, it really started in the OR. Dr. Toussaint and I worked together every day. We worked long hours, and the hours were so long because towards the end of the day, all the hospitals would start sending the nurses home at 3 o'clock, and so we would go from 2 rooms down to 1 room, and it slowed things down. So we would do 8 cases in the first half of the day, and then only be able to do 2 cases or 3 cases in the second half of the day because it slowed down. It just didn't make sense. This is what they did for a living. This is how this was their business, and they were basically shutting us down. So we thought we could do it better. And so it really started as efficiency and being able to do what was best for the patient. If you have a patient that comes in at 10 in the morning for a 1 o'clock surgery and that gets put off till 6, 7 at night because they've shut the OR down, that's not good for anybody. And so it really started from a practical manner.
What do you say to a patient to tell them how much better Forest Park is and why they should have their procedure done here?
I think we do it better. I think we do it more efficiently, and I think the patients have better comfort.
Thank you, Dr. Barker. We appreciate your time.
Thank you, Candace.
And stay tuned as we meet another Forest Park physician that is changing people's lives.
To watch the full video, go to pinklovedance.com and be sure to vote for Forest Park Medical Center.
I was at my fitness center and I was playing basketball, and I was reaching out to get the ball, and somebody's forehead actually slammed into the bridge of my nose and broke my nose immediately. I immediately knew I broke it because I heard a pop.
Often patients come in and have either seen previous doctors or oftentimes had previous surgery where it's been inadequate in assessing those outside parts of the nose. And so when we see the patients, we obviously take a very careful history from them and to do a careful examination. And if we determine that they have a problem in which the outside portion of the nose is contributing to their obstruction, that's typically when we recommend functional rhinoplasty.
I noticed that I was having breathing problems. Throughout the day, I would notice that I'm struggling to breathe, and especially at nighttime. While I'd be sleeping, I would wake up in the middle of the night sometimes and just gasp for breath, and I have never in my entire life had problems like that.
The surgery is highly individualized based on the patient's individual problems. It can last anywhere from an hour and a half to 4 or 5 hours sometimes, depending on the complexity of the problem and the patient's individual history. Have they had previous surgery? What types of collapse are they having? How much cartilage they have left over in their nose, and do we need to reconstruct that, possibly with even cartilage from elsewhere in the body?
After the surgery, I woke up and I had the splints, I had the bandages on the nose, so I was not able to actually breathe directly after the surgery. The recovery period, I think, was around 2 to 3 days for me.
Although there is some discomfort associated with the surgery, most patients by a week or 2 after surgery are very glad they've had it done. Not only are they breathing better, but they're pleased with the outside appearance of the nose.
A week after the surgery, he removed the splints and the bandages on the bridge of my nose. That's when I took my first breath. And I immediately knew that something has changed because I was breathing out of both nostrils, which I've never done before my entire life. It was a life-altering experience. I remember I was at his office and I was just so happy, and I think I gave Dr. Pero a hug.
Forest Park Medical Center set themselves apart by being committed to providing their physicians the latest state-of-the-art technology in medicine. As this week we feature the MAKOplasty robot.
The MAKOplasty is a robotic adjunct for joint replacement. It's good for inside of the knee, the outside of the knee, or combined inside and what's called patellofemoral or underneath the kneecap arthritis.
It's relatively advanced technology that helps increase the precision of the surgeries that we do. A lot of the orthopedic surgeries in the joint replacement field have a lot to do with measurements and alignments, amounts of cartilage and bone that we remove in order to replace either that exact amount or some variation.
The ideal candidate for MAKOplasty is anyone who has usually mild to moderate arthritis that's confined to one. There's basically 3 compartments in the knee: the medial or inside compartment, the lateral or outside compartment, and the anterior compartment, which consists of a groove called the trochlea and the patella.
So having technology in this situation with Mako using the robot, which helps you to execute the plan that you have preoperatively to achieve a certain result. The robot is actually helping you during surgery. But a big part of the technology is the information that we get from the computer system with the preoperative study to help plan the surgery before we ever make an incision.
How Mako is different from the standard partial knee replacement is the excellent reproducibility of putting in the implant. One of the more difficult things about doing partial knee replacements is getting the implant in a good position and maintaining the soft tissue structures. The way the Mako system works with the CT, we do a CT scan and it tells us we can set exactly where we want our resection level to be, the exact angle of the implant, and it's 100% reproducible from our plan based on the CT scan. It's impossible to have that done any other way than with the robotic surgery. It will literally stop you from making a mistake.
Overall, MAKOplasty knees are a significant improvement on a partial knee replacement that we've done for many years, and because it's done better and more precisely, it allows us to open up to a larger potential group of patients and get better short-term and long-term results.
It's literally the minimum of minimally invasive surgery for knee replacement.
For more information on any of the Forest Park Medical Center doctors that you've seen on today's show, just log on to our website, bestdocsnetwork.com, and click on Forest Park.
That is the place to go. Right now, the place to go, Candace, let's revisit Kelsey Reich, who has more on our next doctor. Kelsey?
Thanks, Jim. Now for our next Forest Park Medical Center physician, gynecologic oncologist Dr. Jonathan O. discusses the latest in cancer research and treatments for women.
When you hear stages of cancer, basically stage is just a way of classifying how far the cancer is spread. And every disease type has their own way of staging things. So the staging for breast cancer is not going to be the same as staging for ovarian cancer, obviously, because it's completely different diseases. But that's generally what we're trying to do, is trying to get an idea of how advanced the cancer is. And once we know how advanced the cancer is, we can generally give people an idea of what the prognosis is. That's ultimately what's important. You're not so much worried about stage, you're more worried about, are you going to be able to cure this? So, and stage kind of gives us an idea of what the cure rate would be. For gynecologic cancer, after surgery and what we call adjuvant therapy, and adjuvant therapy will just be either chemotherapy or radiation after surgery, patients undergo what we call surveillance. Surveillance is just a fancy term for keeping a close eye on things. Typically, we have the patients come back in to the office anywhere from every 3 to every 6 months for an exam and blood work. We want to keep an eye on things to make sure that the disease doesn't come back. Chemotherapy is just a fancy term for medical therapy. Traditional chemotherapy is an IV infusion. So just like if you were to go to a hospital, you get an IV placed, and these are medications designed to help kill cancer cells. And for the most part, the way I describe it is it's very expensive, very well thought out poison. And it's poison that's designed to help kill cancer cells before it causes too much damage to normal cells. Length of treatment depends on the type of cancer the person has and the treatment option that they decided for. But usually it's about a 18-week treatment course. There's a number of trials that are ongoing through our research division that's based out of Mary Crowley here in Dallas. We have a number of clinical trials open for not just gynecologic tumors, but also breast cancers and multiple other disease sites. We have targeted therapies. We also have tumor-specific options, such as vaccines. So a lot of these tumor vaccines are created at the time of surgery, where samples of a person's tumor is sent to a lab, and this lab creates a vaccine targeted specifically against that person's tumor. That's something that's under clinical trials here in Dallas that I'm very actively participating in.
In our practice, we take a team approach to the nutritional aspects of bariatric surgery. And we feel that patient education is, first and foremost. I have a registered dietitian, I have a nurse practitioner, both of whom are very knowledgeable about nutrition in general, but also nutrition for bariatric patients.
After duodenal switch, there are a lot of changes that happen in a person's body. Having undergone the procedure personally and having a medical background as a medical doctor, that is, I feel, my role in this office. I like to take people from where they are, educate them about the procedure, make sure they understand what they're getting into before they ever commit to going under the knife, and then afterwards understanding the changes that they've done and how to maximize their health.
Dr. Buse has actually been involved with our patients, even though not officially, through his interactions on Facebook and other media. He has started at least a couple of support groups and goes to the meetings and talks with people. And so we've just had a lot of patients who said, where can I see Dr. Buse? Now that we're opening our office in Frisco, and now that he's relocated to Frisco, that's going to be a perfect opportunity to get him involved and actually seeing patients in our office right alongside with us. And we're really excited about that.
After duodenal switch, there are a lot of changes that happen in a person's body, metabolically and physically. Not only do people lose weight, but they absorb nutrients and vitamins and minerals and calories in a whole different way. We try to take just kind of a holistic approach to making sure that they are doing what they can to supplement well and to get as much of the nutrition they can through the foods that they eat.
Give patients what we feel are solid guidelines which will help them to maintain their nutrition. If the patients will take the time to spend the time with me or my staff, eventually we can solve whatever the issues are.
Time for one of the best plastic surgeons that operates right here out of Forest Park Medical Center. It's Dr. David Azouz.
A couple of years ago, I decided that I needed to make some lifestyle changes, and I lost about 50 pounds and just started to get healthier, and I started feeling so much better. And I decided that I really didn't look as well as I felt.
Donna's a very attractive woman. I think she has beautiful bone structure. Although she does not dye her hair and she has white hair, she has a very elegant look. But I think she had very prominent jowls. She had an obtuse cerviconuchal angle, which means that her neck went from her chin down straight, which you could see in her preoperative photography.
I didn't want to look like a 25-year-old. I just wanted to look like my well self. He did my eyes, underneath my eyes, the bags under my eyes, which really made such a huge difference. And, pulled up the neck and, so that this is really clean in here. And I had, with the weight loss, I had a lot of hanging skin, and he, took that away, so that was wonderful.
Afterwards, she looks natural. She just looks a lot younger and a lot better. I mean, people I don't think would believe that she was in her mid-60s.
As of right now, I'm about 6 months post-op. I'm thrilled with it. I really am. It looks natural. It doesn't look pulled. I look now like I feel.
So overall, you have a very natural and refreshed look. You look like you've been vacationing or you're well rested, and people know you look a lot better, they just can't place it.
You really have to be comfortable with the doctor that you're going to. He answered every question that I had, didn't hesitate to say, if you change your mind the morning of the surgery, it's no big deal. It's up to you. You know, nobody's pressuring you. So I just felt comfortable with him.
I had my surgery at Forest Park Medical Center in Dallas. When I walked in, I was completely blown away by the facilities. I mean, just a beautiful facility. Just the technology there was great, and it was very exciting to me. Teleprompters that gave the family updates, and the beeper system, and that let the family know what was going on. Went to the admissions table. The ladies there were fabulous, took care of everything. The care was top-notch and great, and I was very excited about being at Forest Park Medical Center, and a great facility.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
The Da Vinci robot has been used extensively in gynecology since about 2008, and it allows us to do major surgery on patients that used to would facilitate a large incision, but now we're able to do these through smaller, minimally invasive incisions, allowing the patient quicker recovery and quicker return to our normal activities.
I work a full-time job. I perform on the weekends. I'm a jazz blues singer. The recovery time seemed to me to be a little bit more because of the weight issue. But the robotic procedure kind of lessens that fear.
Wanda was having a lot of pressure down below, and she stated that she felt like things were changing inside of her. She knew she had the fibroids, but she felt like they might be growing again. We did a sonogram. It showed that her uterus and fibroids collectively were about the size of a volleyball, and definitely could be causing the pressure and the abdominal pain that she was experiencing. It's kind of like a muscle cramp in the uterus. And unlike muscle cramps in our other muscles, these muscle cramps don't go away, they stay.
He explained the process to me, and I said, this is the person who's going to do the surgery. And there's another procedure, but the procedure was done. And within less than 2 weeks, I did a performance. I was very pleased with the outcome.
Well, we did her surgery in mid-afternoon or so. And I saw her that night. She says, I really could go home right now, but I think I'll just stay. So we kept her overnight the next morning. She felt great. She was ready to get out of there. I saw her back about 2 weeks later, and she had already done her first performance. I think she said it was 10 days from the time she had her surgery to the time she was back on stage.
I know my doctor said, don't do anything, don't drive for at least 3 or 4 days, but I felt good, you know. So, you know, I would recommend this to anyone who is thinking about having this procedure.
Thanks for tuning in, everyone. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, one of the best medical centers in all of Dallas-Fort Worth.
You are exactly right, Candace. Not only one of the best medical centers in the Dallas-Fort Worth area, but how about this? Some of the best physicians in the Dallas-Fort Worth area operate out of beautiful Forest Park Medical Center. And with more on that, you can head to the website bestdocsnetwork.com, click on Forest Park.
Absolutely, and don't forget, we want to hear from you. If you have a question or comment, send us an email at info@bestdocsnetwork.com.
That'll do it, and we will see you next week.